Hey everybody. I wanted to kind of give you an update on me. I talked about it a little bit on the O the Anthem podcast. So if you haven't checked that out, you absolutely should. It's available at otheanthem.com, youtube.com/O the Anthem, and basically everywhere. But for those of you who have sent me messages, thank you. Despite my somewhat evasive answers for the last week or so, I've been kind of noticeably absent on social media for like the last 7 to 10 days and just trying to like basically get by. And I kind of want to update you on what's been going on and why I've been absent, I guess. I guess the place to start is at the beginning. So that's what I'll do. Back in January, when we first started getting news about coronavirus and how it was spreading from China elsewhere, I jokingly bought everyone who I was living with at that time um, face mask, gas mask, the N95 P2.5 filtered mask that they could wear. And then I actually bought as kind of a joke, but also kind of a functional thing, a full face mask with the dual filters that kind of you see like painters or sanding equipment operators use. And I got it as a joke because every time somebody mentioned something about coronavirus or had a cough at work, I would strap on this big gas mask. This is actually the mask right here. Whenever somebody would cough or, early on when we were making a lot more jokes about it, I would strap this on and then just walk around work like so. And as you can tell, it's kind of hard to hear me. Now, this is a legitimate mask. If you can hear me, that is a legitimate mask. When it's all sealed up correctly, it's supposed to protect you from anything that is less than 2.5 microns, which is much smaller than any virus. Realistically, this is like protection from tear gas or any kind of gases that anyone might fire at you, and it is 100% protective seal. Obviously not for the eyes, but for the upper respiratory system. So when it's operating correctly, you can lock it on and you can test it just to make sure it's sealed. Like it's a legitimate piece of equipment. And it cost me like $40 or something like that. But I got it as kind of a joke, but also we're doing some renovations at my office. So whenever they were sanding, or I walked out into the environment where the rest of the employees couldn't go, and I just saw like a fog of something, whether it was from the concrete floors or sanding wood or cutting wood, and I knew I had to be out there for a while, I would actually just grab it and utilize it for that. So it was somewhat functional, but also gave me ability to joke whenever anybody talked about viruses. But I also had just like your basic, like a black face covering that is good for coughs and wearing in public. I did an Instagram video about where I wore that mask as a joke kind of early on as well. I refuse to live my life in fear. And that's why I am heading out into the world, as empty as it may be. And I'm not saying I'm scared of anything at all. I'm just saying. So you came back to die with your city. Huh?
Huh?
I'm wearing the mask. Years from now, when we're confused about why Rob is wearing a mask, it's March 2020. Corona is a thing. It's a thing. So as January became February, I actually got those masks because I knew I was going to be flying to New York a couple of times, and I wore it on the flight to New York and the flight back. Even though Corona wasn't really affecting the United States at that time, it was in Seattle and limited amount in New York. I just did it as a precaution. It's good just when you're going to take a weekend trip and you kind of can't miss a beat. Like Friday I was working, or Thursday I was working, flight overnight. Friday in New York, Saturday, Sunday had a lot of stuff to do. Fly back Sunday, got to be at work Monday. So I couldn't even just catch like the flu or a cold or any of those travel things you can sometimes pick up. So I thought it was a good investment just for that. January became February. I took all of those trips and we still weren't under any kind of travel warning. There was no like sight of what it would become or what it's become since then. Felt all right. And again, kept up the jokes with the mask, even though the story started to spread a little further. And then February became March. And obviously, in March, we got a little more serious about it. Obviously, it was spreading much wider in the US than anybody had predicted. I was trying to keep people calm and just say, even at this point, honestly, the regular flu has killed more people in the U.S. than coronavirus, and there's a lot of things that go around every year that kill more people than coronavirus. But obviously, I had some concern about it. Part of my role at work is to try and keep people calm about situations like this, even though I may be kind of internally thinking a little differently about it. And as part of my role there, I think it kind of infected the way I was thinking about the world around me. And I, to my detriment, didn't really change a lot about what I did. Now, luckily, I wasn't somebody who's going out all the time. I'm not a barfly, and I don't even go out to dinner a lot. Those of you who know may know. Roxy moved to New York at the end of February, so my reason for kind of like being out and about doing anything kind of lapsed at that point. I was looking for an apartment, so I was kind of in and out of places looking for a new place. And then I noticed that a lot of the postings were starting to disappear. And I think that was probably the first signs that people were getting sick in LA and that it was spreading a little wider than even the news was kind of talking about at that point. But for the first few weeks of March, it was kind of business as usual. Here in LA, we didn't see a lot of the impacts that people were seeing elsewhere. I was worried about Roxy being in New York because I saw that it was getting a little out of control there, more than it was here. Washington, kind of the same deal. And I had thoughts about flying to her in New York to try and convince her to come out. I tried to get her a bus ticket, I tried to get her a train ticket, anything that would get her out of the city. And luckily, she did eventually leave. By that time, we had actually started taking precautions here in LA as well. And fortunately, unfortunately, I guess depending on how you want to look at it, all of the postings for apartments and roommates and that kind of stuff just kind of dried up because everyone was in this mode of let's wait and see what happens. Obviously, inviting a stranger into your home when there's a pandemic on is not necessarily a great thing. And I use that word pandemic sparingly because I think people have used it in order to just like fearmonger and to scare people. But realistically, there are two different words that are used, epidemic and pandemic. And an epidemic is just when a virus or a disease or a bacterial infection spreads throughout a population. And typically, like the World Health Organization and the UN use that to mean like inside a country, something is going crazy, but it's contained within that country. That would be an epidemic. We in the United States have an epidemic of food, especially sugar-related diseases, obesity-related diseases. And that is not something that's shared worldwide because not everyone has our diet. It's just specifically in the United States. A pandemic is when the impacts of an epidemic, or it doesn't even have to reach epidemic proportions inside a country, but the impacts reach outside of that country's borders. And when a virus that started in China starts spreading to all of East Asia, Southeast Asia, South Asia, we're seeing some impacts in Europe and in Middle East and North Africa and in North America. Now we have what's called a pandemic. It just means that this virus, this bacterial infection or this disease has spread from one area to another and it's infecting populations. It's not just that someone comes from a place and happens to be from somewhere else. If you have been around long enough, you've noted a couple of Ebola outbreaks that were epidemics that didn't become pandemics. Even though we had cases here in the US, they had cases in Europe. Basically, the inability of the virus to spread from person to person easily meant that someone who went and got the virus somewhere else and then took it home and was sick at home, because it didn't spread widely at home, it wasn't a pandemic. It was just an epidemic to which someone who is a foreign national was a victim. So a pandemic isn't necessarily something that impacts a lot of people. It can just be something that impacts a population in multiple places when it originated in one place. We've kind of reached a new degree of pandemic, and that is this is an insidious virus. It is a survivor, to describe it beautifully, I guess. It is a virus that has a 2 to 3 infection ratio, which means that, if I was to expose 3 people, 2 of those 3 people would be infected from it, statistically speaking. And then of those people, 2 or 3 people that they infect, likely 3, that they have infected, would also come down with the virus. So that is a really high infection rate. And even though the death rate is very low, a high infection rate means that it can reach vulnerable communities and people that aren't 36 and have access to really good health care and are in relatively good health. And I say all that just to say that I did not take it as seriously as I should have from the beginning. And I did not make the changes to my life that I should have from the beginning. Part of that is just my understanding of the way pandemics work and how this was likely to burn itself out before it got serious. That's not what happened. We are obviously in the midst of the burn. It's not anywhere close to burning out. And it's impacted LA greatly. We are now modifying our lives to a great extent because of the virus. But I also kind of say that to excuse the part that I'm going to tell you next, which is I was really dumb and I didn't change my life. And because of that, I have not felt great. And when I say I don't feel great, I have been sick for the last 10 to 14 days or so. So by March 13th, obviously things were really fired up even in LA, here on the West Coast. The Bay Area had become a hotbed. Seattle was a hotbed. New York was a hotbed. And the governor and the mayor had decided that a stay-at-home order was going to be the thing to do, and that all non-essential personnel should be not coming to work. So for the most part, my office went to a work from home kind of breakdown. It wasn't enforced. We didn't force it, but we did encourage people to work from home. I was one of those people who wasn't working from home. The end of another long story, I no longer have a car in LA, so I don't have a way to drive to work, which meant that my main route to get to work from where I've been staying downtown to my office in Hollywood was to take rideshare. And that's Uber and Lyft. And I didn't take any public transportation, although I have in the past. I have to say that part of that made me nervous and I didn't do it, even though some of the people who came into our office were still using public transportation, which means that I'm still exposing myself by having them come to the office. I'm still being exposed to anyone that was on public transportation with them. So starting on the 16th, we had to work from home, not enforced, just by choice. And most people chose to stay home, given what they were seeing on the news and on social media. And that was the right decision. And by the 19th, the governor and the mayor had decided they were going to do a full enforced stay-at-home order, and that non-essential people should be staying at home and not going to work. I still went into the office on the 20th, that Friday, in order to make sure that we were kind of shutting everything down for the day. I actually planned on only doing a half day, but instead I ended up working nearly a full day, probably longer than a full 8-hour day at the office, which meant that I was one of the last people to leave. I made sure the office was all like hemmed up and batten down the hatches for the long haul. But it meant that I was exposed to probably more people than most of my cohorts there. But I'm getting a little ahead of myself in the story because on the 17th and the 18th, that Wednesday and Thursday, I started feeling not exactly right. And there's a lot of reasons that could be. Without everything happening, I would think that a little bit of fatigue and a slight cough are just normal parts of my life. I don't sleep well and I don't sleep much. I find myself working pretty long hours, either at the office or on office stuff at home or on my own stuff at home, doing videos for you guys. So being tired on a Thursday or Friday at the end of a week wasn't a huge difference for me. And not feeling great is just kind of the norm. Still trying to figure out what 36 is exactly. I feel like mentally I'm still 21 and I should just hop out of bed no matter what. But I'm at that phase of my life where a hangover takes 2 days to get over. And I just wake up every morning wondering what new thing is going to hurt today. So I didn't pay it much mind until that Friday. Obviously, I was one of the last ones in the office, and I knew that something wasn't right. I wasn't feeling great. I had a fever, even though I didn't know exactly how high that fever was. I had a cough. Now, was that cough because of the vaping? Was it because of something else? I don't know. Both kind of produce a dry cough, so who's to say exactly? But I knew that I didn't feel great. And I knew that I was kind of looking forward to the weekend as a time that I could recover and get through whatever it is that I was experiencing. But I didn't get any better on Saturday. Saturday the 21st, I woke up and my slight fever had become what they would call low-grade fever. That's something between 99 and 101. And I had body aches. I had a tightness around my chest, like kind of in this guess you guys can't see it on camera, but like right around the bottom of my rib cage. For anyone who's had a broken rib before, and he had to tie it up with some bandages, with like an ace bandage, felt a lot like that. Like I was wearing a spandex band around my midsection, and it made it feel like I couldn't like get my diaphragm to inflate all the way. So I wasn't really having trouble breathing, but I was noticeably not breathing as well as I usually do. And the roommates took note that at occasion I didn't even notice it, but they could notice that I was breathing really hard. And luckily, I wear a smartwatch, which keeps track of my heartbeat, and I could tell that my resting heart rate was way up. Most likely because I was having trouble breathing. So the heart pumps more blood so that we get more oxygen to the muscles and to the organs, but then that also causes you to breathe harder as you're trying to match that heart rate pace. So on Monday, I still had a low grade fever and I didn't feel fantastic. And that's Monday the 23rd. I didn't feel fantastic, but I was smart enough to say I should not come into the office, that I should work from home. And I let the folks at work know that because I don't know what's going on, but I'm in this kind of gray area here. And I had a call with my doctor, and I encourage people who are feeling any kind of symptoms, please reach out to your doctor. Don't just go into the office, but most insurance companies, most doctors' offices have, email visits, teledoc visits where you can just call, FaceTime where you can do a FaceTime with your doctor and they can actually see you. I've taken advantage of all of these in the last 2 weeks, and I really encourage you that if you're not feeling not right, to do that. But I had a visit with my doctor, a teledoc appointment, and she said basically, you have some of the symptoms, but not all the symptoms, and nothing that really worries me. So at this point, we're just gonna, kind of leave you to be at home and get over this. She said that truthfully, we're at the end of flu season, and I got my flu shot anyway. So the likelihood that it was the flu or something else is very low. The likelihood that it was a cold, again, we're in Southern California and the weather's already warming up. So the likelihood that I had gotten like a rhinovirus or an influenza was probably low. The likelihood that I'd gotten a mild version of the coronavirus was high. Was it COVID-19, the novel coronavirus? Who knows? There's a lot of coronaviruses. But my symptoms didn't need me to be hospitalized, and I didn't need to see anybody in advance. So stay home, stay isolated with the people you're already isolated with, the ones you've already exposed, and try not to expose anyone else, and go on with your life. So I did. And as the week went on, I checked in with my doctor again on Thursday, and I told her that the fever had not progressed. It was staying stable in that 99 to 100 range, and that the other symptoms were still there, a small cough, tightness in the chest, that feeling of a spandex band around my midsection, but nothing that was bothering me so much that I thought I needed to escalate it at all. And she continued to tell me just stay at home. She thought that maybe it was less likely that I had coronavirus at that point, but that it could be anything, and who knows. And seemingly bad day for it that Friday, and that's Friday the 27th, my low-grade fever just decided to kick it up a notch. And I went from 99 to 101 to 102, 103, as high as 103.9 at one point. So the fever was getting a little more out of control. And I sent an email to my doctor, and unfortunately I missed it and the office was closed. I still didn't feel so bad that I needed to go get checked out right now. I didn't feel like it was an emergency room or an urgent care thing, and maybe that's just me, because I know how overstressed the whole medical profession is in LA and everywhere right now. And our whole goal is to flatten the curve, and flatten the curve is not about anything else. And maybe it's worthwhile just to take a moment to talk about that. So the reality is that 80 to 90% of everyone will get the coronavirus, this novel coronavirus at one point. Flattening the curve is not about stopping people from getting it, but it's about making sure that we spread out the cases so that they don't peak hard and fast, that big tall curve you've seen before, and stress out all of the resources that we have. Yeah, I'm sure you've heard stories about ventilators and not having enough of them, and we're running out of gloves and N95 masks and personal protective equipment and all of those things, that hospitals are just strained to the gills. And I saw that. I'll get to that in my story. But flattening the curve is just not about keeping people from getting sick. It's about delaying the time it takes for all the people to get sick. Because if you think of it as a line graph where the Y-axis is the number of people sick, and the x-axis is time. If we have 10,000 ventilators and I can make sure that only 10,000 people need them at any one time, then that means we are at capacity, but we can service everyone. If over a, let's say, 10-month period, we have 100,000 people who need ventilators and we have 10,000, well, that means that we've hit the curve and we run parallel to capacity until it falls off again. If in 1 month we need 100,000 ventilators, well, we've surpassed our capacity and now we are in the zone where we don't have capacity to service everyone. Maybe it will be that 100,000 people in the LA area need ventilators, but if we can spread that out over 10 months, and 10,000 a month is way easier for us reaching capacity than 100,000 in 1 month. So that's flattening the curve. And I know that a lot of people are scared of catching the virus or what it's gonna do. But the reality is, with a virus like this, 80 to 90% of people will, in fact, get it at one point or the other. This thing is likely to burn hard and hot and fast for a long time. It'll die off. We'll feel like it's all over. Everyone will go back out. And everyone who's not been naturally inoculated by having it already will get it in the second round. There may even be a third round after that, where people who haven't got it yet will get it after we re-embark in our quarantine. So we want to flatten the curve just to make sure that the number of patients doesn't exceed the capacity of the medical system. And I'm not going to get into my thoughts about the American medical system and how we've been running the system about trying to match capacity to service need for a long time and how that doesn't prepare us for situations like this. That's for another time. I also don't have the energy to dive into that kind of deep political and research-driven drive. Fact of the matter remains, on Friday, I had a much higher fever, and although I still wasn't having any trouble breathing, I didn't feel as though there was any liquid, like water on my lungs. I had that pressure, but it was just about the same, increased some, but not exponentially so. Cough was getting worse, but not so much worse. Temperature was up, and that was worrisome. So I just waited until Monday. I survived the weekend by basically sleeping the whole time. And let me tell you, I have reached a level of fatigue that I have never felt before. Just my 20 minutes into this recording, and I am exhausted and like trying to get to the end of it. But the fatigue is kind of pushing me, and the brain fog of trying to get through the story and everything that happened is killing me right now, honestly. And that was the worst part over the weekend, was just feeling like I couldn't figure out simple problems. If I had had my nephew's little toy set with the square and the triangle and the circle blocks, I don't know that I would have easily been able to get all the right blocks in the right holes. Like, that is how I felt. And I was so tired that getting up to even take that kind of test would have taken more energy than I think I had. I probably slept 30 hours of the 48 hours of Saturday and Sunday. But on Monday, I checked in with the doctor again. I let her know all of the updates and symptoms. She was much more concerned. She escalated it to a different doctor. I spoke to that doctor on the phone, and that doctor recommended that I go to urgent care, but they couldn't do that without a second opinion. So my file was sent over to yet a third doctor. Now, all three were recommending that I go into urgent care and be seen. So I called out from work because, again, I had been working at home the week before, and I went into urgent care. And I said earlier that I kind of saw how stressed the medical system is. Trust me, it is very stressed. There was no one in the open entryway area of the hospital. We all kind of had to stand in a line, grouped together, which was strange. I had my full mask on, as I have every time I have to leave the house now, if it's not just to go for a quick walk. And I haven't left the house in 4 days now, other than to go to the hospital. Before that, it had been 2 or 3 days. So I haven't left very often. We were all grouped together, and basically they come in and check, what are you here for, a prescription pickup, or are you here to see somebody, or have you been referred? And I was there to be referred, so I got a yellow sticker rather than a red sticker or a blue sticker. And then I got funneled out to the trauma area, and they just use trauma here just to classify people before they come into the hospital, basically. So I sat for a little bit in chairs that were 6 or 7 feet apart. Where I was sitting is actually the parking lot of the hospital. I suppose that was probably for sanitation issues. It's a lot easier to kind of keep that area clean than it is to have me walking around and touching things all over the place. But we are stressed to capacity. They're putting patients in a waiting area in a parking garage. People were coming in and out of the garage looking at me with my gas mask on, falling asleep in my chair because I was so tired. But eventually I got seen by one of the trauma physicians there, And they did a full workup on me. She listened to my lungs. She checked my BP and my heart rate and pulse ox. And pulse ox is down, which is where the brain fog is coming from. And there's luckily no sign that there's any kind of congestion, no upper respiratory problems, other than the cough, which is just at this point, well, I can get to that. But fever was up and the pulse was up and blood pressure was up, but otherwise healthy, right where I should be. Luckily, I am now a member of Kaiser Permanente system, so all of my records were easily available for them, and they could see the workup I had 8 weeks ago, and they compare that to what I had today, and they could see the differences. So it was super easy for that measure. While I was there, I saw a case of tests that were for coronavirus, and I asked about getting a test, and what I was told is that I didn't meet the qualifications for testing. I don't care for, nor am I in, a member of a vulnerable group, and I couldn't identify a positively tested person who I'd come in contact with. I'll probably do a follow-up video at some point about my thoughts on that, but without putting my conspiracy hat on right now, I'll just say that I wasn't able to get a test. And that's despite 3 doctors who had been treating me over the past 2 weeks saying that I should go in and be tested just so I could confirm whether or not I had it. What instead I got was a diagnosis of an influenza-like illness, non-confirmed, which apparently is their speak for you probably have coronavirus and we have no other explanation for it. And you didn't test positive for any of the other tests that we run, but we only have so many of these tests and you don't qualify for it. So we can't give you that test. So she gave me some advice about continuing my over-the-counter treatments and to make sure to keep an eye on a certain number of things, like did the dry cough increase? Do I feel an increasing pressure in my chest? Does the difficulty breathing get to the point where it's uncomfortable? And when breathing, does it sound like there is, liquid, like a wet breathing sound? And it's hard to describe, I think, but I kind of described it to her and she was like, that's exactly what you're looking for. And I'm like, great. So if I have any trouble sleeping or staying asleep, which can be a sign that the body is like waking you so that you don't drown in your own fluids. But if I had any of those reasons, I should come back, of course, after calling my doctor and getting a referral so that I got fast-tracked through the line. Other than that, go home because I am a stay-at-home case. And what that is somebody who's relatively young and relatively healthy, who isn't going to expose a vulnerable population, and who can just go and sweat out the fever and cough out the coughs, the upper respiratory portion at home, and make it through without other further treatment. So that was Monday the 30th. And I took off Monday. I took off Tuesday. I worked a half day today. I did work a little bit yesterday as well. But I am basically just saying, well, if I can't get any treatment and I can't get any diagnosis, I'm just going to push through and I'm going to treat this like I would treat any other illness. And for me, that's just kind of ignoring it and trying to do the best I can to treat myself. But that is a very long answer to a very easy question, which is where you been? How you feeling? The answer is I feel really, really crappy. The fever has not let up. I joked on the podcast that over the course of like the hour that we were going, my fever turned to chills and back to fever and then the chills like twice or 3 times and fluxed back and forth so that I was sweating while we were going and then I would get these chills that all the sweat would make me cold. And then after a minute, 5, 10, 15, it would go back to fever again and I would start sweating again. So, and even while I've been doing this, I had gone through 2 cycles of the fever made me sweat, and then I got chills for a little bit, and now I'm back to the fever making me sweat more. It's not fun. But I wanted to do a video because I think that there are a lot of people out there who are still ignoring all of the things that everyone is telling you. And I hope that if you watch this, if you see this posted on Facebook or Instagram or anywhere, that you can say now, hey, I know someone who is dealing with this. And they told me, the person who is dealing with this, to stay home. Stop leaving if you absolutely do not have to. I get the desire to want to get out. I'm going stir crazy here as well. I think I'm driving everyone here a little bit crazy. But we have to do this. We have to try to flatten the curve out. We have to try to minimize infection rates because things are bad out there. And every time you go out there and you don't have to, you run the risk of making it worse. You become the next patient who needs medical care, or you risk taking the infection you already have but isn't showing symptoms yet. Because keep in mind, I probably was infected for a week before I even knew. And I was exposing Uber drivers, I was exposing people at work, I was exposing any number of people, including the people I'm quarantined with, all that time. So stay at home if you don't have to. That's my overarching message, is from somebody who's dealing with it, stay home. Let's make this an easy as possible time to get through. But I also wanted to reach out to people, one, so that you can see that I'm perfectly fine, relatively healthy, and on the surface, I look fine. But that this is an insidious virus, and the way that it infects you, and the way that you can infect others, and the length of time before you show symptoms, and even the way that I feel moment to moment and day to day, has an insidious nature. I think that Chris Cuomo, who has now been announced to test positive, put it best when he was on Anderson Cooper yesterday, and I saw him talk about it.
Look, I mean, you've had something kind of like what I'm dealing with right now. Really? Well, I mean, you've been somewhere in the world and you've got like a flu-like virus that can be bad, right? So it's sneaky because you think it's something else. A doctor told me today, flu season's basically over. Sinus infections and all those things, basically over. Allergies, yes. But if you have anything that is draining you and giving you aches and fever, it very likely is this. And it kind of comes in waves. I can't do anything. Hopefully I'll be able to keep doing the show, but I don't know what the path forward is for me. So I wanted people to know that I have it because, one, if you think you're too strong for the virus, you're wrong. And if you think the virus is a death sentence, you're probably wrong. And I just hope people get the sense of the urgency we all need to have by seeing that I have it, for better and worse.
You're obviously just early on in this. Did they tell you like what to expect moving forward, or is it kind of different for everybody? I mean,
that's the spookiest part, is they really don't know. And I've never dealt with that before in my life, where, usually whatever I have, they know what it is and they tell you about it and here's what you do and here's what you take. They don't know. And there's like nothing to take. And people throw all these remedies, malarial drugs and all that. The experts say, not only do they not know what works in these early protocols, but there are a lot of side effects and things that can happen for people. So it really is suck it up time. The best medicine is to not get it, prevention.
But that is the best explanation that I could give. From moment to moment, I feel fine. I will go through an hour and a half where I'm just like, let's go. And then it's as if somebody just drained all the energy out and I hit the wall and I got nothing left to give anyone. And I'm about to hit that point right now after a half-hour long recording. So to anyone who was worried, I'm alive. I'm still here. I'm not expecting to go anywhere. I'm still at the point where I'm joking about dying. So I don't think it's going to be that big of a problem. But you all now know someone who is dealing with the virus, and you should take it very seriously. That means staying home unless you absolutely have to, only leaving for the necessities. And even though you're staying at home, and doesn't mean inviting people over to your house, because that doesn't help. If we were to have a party right now, the 5 people coming over, yes, we're technically not violating any of the stay-at-home orders and none of the problems. But I have a chance of impacting those 5 people who are going to take it from here out to their places wherever they're quarantining, and those 5 people there. And then they go to a different part. It's just this cumulative effect of the way that it can spread. It is huge. And we just need to try and quash this thing while we can. So stay at home. And I don't know how much energy I'm going to have for it, but I'm totally up for questions. If anybody has a question, feel free to put it in the comments down below. Or to send me a DM. I'm happy to answer any of those. I've been keeping a journal through this. I don't really know what the point of that was. I think I was scared when I first realized that I was showing symptoms that this might be it for me. And I wanted to make sure that I chronicled the process. Or when I was speaking to the doctor at urgent care, and I kind of went through the steps in my head because I'd read the journal right before I left. And I went through all the steps. I was able to push through the brain fog and all the fatigue and just say, here's where I was, step by step. And she was just like, that was a fantastic retelling of your symptoms over the last 10 days. I wish people would come in here with that kind of like focus in it. And I just told her, I'm like, I didn't know what was going to happen. And I wanted to be sure that I had all of the steps, all the stages down. And I have it for myself in even greater detail than I'm going to you here. So I don't know what's going to end up with that. Maybe it'll end up being a book or, the start of a deeper dive conspiracy study. But again, that's for another video. But yes, I'm still here, still fighting, feeling really crappy, but every day I feel a little better now. Treating it as best I can from home. I would say that even if you're like me and you can't get a test, it doesn't mean that you shouldn't just act like you have it anyway. Isolate yourself, try to eat as good as you can, and treat with over-the-counter meds as best you can, and push through to the other side, because the choices that we make right now are not just for us. We're making choices for our neighbors and for people in our city, people in our state, and people across the whole country, and even in ways the entire world. We want to make sure we make good decisions. I don't know if anyone knows how they would have acted, back in World War II or the Depression, when everyone was asked to sacrifice for the greater good. But you're being asked for a very small sacrifice for the greater good right now. I'm being asked, everyone's being asked for the same thing. And we can only really get through this if we all agree that we're going to do what's in the greater good right now. So try to do that. Stay at home unless you absolutely have to. So thank you guys for checking out this very long video. I hope that you stayed awake through the whole thing. And again, if you have any questions, happy to answer them whenever I have the energy to do so. You can hit me down below. If you're looking for a different retelling of the facts, maybe I've missed some stuff, because honestly I can't really tell. I've been trying to do as best I can now, but I talked about it on The Anthem, so you can check out that episode. It's up at otheanthem.com and at youtube.com/otheanthem. For those of you who come around for my other shticky stuff, like the parody videos and the movie reviews, I'm not going to say they're on pause, but they are on slow, because I'm only going to be able to produce them as much as I have already on hand done, or I have the energy to do it. So, well, the time and the energy, because I'm trying to work as well to make sure my company keeps moving forward. We'll see how things go. But I'm in it for the long haul. I want you to be in it for the long haul too. Stay safe, stay healthy, and we'll get through this all together. Thanks, everybody. Have a great week.